Performing a PT test. Make sure that you have all the supplies needed before you start, including a 21-gauge lancet, sample transfer tubes, sterile alcohol prep pads, gauze square, and a biohazard or sharps waste container. For finger stick blood testing, increasing the flow of blood in the finger will help you capture a good drop of blood. Before you lance the finger, have the patient warm their hand by washing it in warm water, or by using a hand warmer. Do not use fingers with tight rings, scars, calluses, or other features that prevent getting good access to the blood. One of the middle or index fingers on either hand is recommended. Gently squeeze or massage the finger to be lanced toward the tip of the finger. Good circulation can be seen if the patient's fingertip changes to a pinkish shade. Lance the fleshy part of the fingertip just slightly left or right of the center. Remove the cap from the single-use 21-gauge lancet. Use only 21-gauge lancets, as smaller diabetes lancets do not produce sufficient whole blood volume. Place the lancet against the skin. Holding the body of the lancet, push down firmly against the finger. Put pressure at the first finger joint, then gently squeeze the finger from the sides to get it started. Lowering the patient's hand and arm so that the fingertip is below the heart helps the blood drop form. Keep squeezing the finger until you produce a pea-sized bead of blood. Please note, squeezing the finger stick site excessively or milking releases interstitial tissue layer fluid containing tissue factors that can cause unreliable results. Collect the sample using a sample transfer tube. Hold the transfer tube below the bulb and horizontal, or with the bulb pointing slightly towards the ground to let gravity assist the filling of the tube. Do not squeeze the bulb of the transfer tube at any point during the collection process. Shift your thumb and index finger to the flat sides of the bulb on the transfer tube, covering the air holes. Rest your hand on the meter. Roll your hand towards the test strip and touch the tip of the transfer tube down onto the bottom of the sample application well where the green light is flashing. Apply gentle pressure to the bulb until the blood just exits the tube. Do not produce air bubbles. Hold that pressure on the bulb while you pull your hand away from the meter to avoid back suctioning the sample. You must apply the blood to the test strip within 15 seconds of lancing the finger. The light should go out and the meter should display, "Testing, please wait." The testing time is the patient's actual clotting time, as the system produces a true prothrombin time. Never add more blood to the test strip. Never collect a second sample from the same finger stick. If an error is displayed, either not enough blood sample was applied or the sample had air bubbles in it, refer to the troubleshooting section of the manual. Remove the strip and retest with a new strip and fresh finger stick from a different finger.